our society is you go patient, you put quotation marks when you're like, wait a minute, something is inferred here. Yeah. So there's a lot. This could be a topic that goes on and on and on and on. I'm going to try to keep it brief and somewhat entertaining. So if you are going to be a physician and you are going to make a legal determination of something, a medical legal determination of something, then the person that you're talking to has to have a relationship with you, a medical legal relationship. Most times we call that the patient physician relationship. But yeah, and so you will probably never see a doctor give medical legal commentary on a person that is not a patient, because technically that's illegal. It's part of our licensure. It's also part of our code of ethics. And so that's why it's super important to define what a patient is. And so let me give you an example. I have a really big family and they're great and wonderful. And they text me all the time about all sorts of questions. And they'll say, Brian, go, 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 go. And I'll go, okay, here's my 2 cents. Now, sometimes I wouldn't say it's medical advice because I don't give medical advice to family members, but there are things that I text back or that I reply back to that absolutely has medical stuff in it, like Adoncia and all this kind of stuff, right? And so, but I make sure to let them know I am not your doctor. It's one of the reasons why we do that big disclaimer at the top of the every mental health office hours, or if we're on social media, or if you look at a doctor's social media, they will always say, these opinions are my own and not reflective of my employer, and they are not medical advice. Because the minute you start giving medical advice to people, if you're not careful, it can be construed as a patient-physician relationship. And so for me, we make sure that you're a patient by having you sign paperwork. And so when you come into my practice, we lay it all out for you. You consent, meaning that you're getting into a relationship with us. You are saying, yes, I will give you money. Yes, I will share my life with you in return for medical advice. And that everything will be confidential, because that's the other part is that is part of the patient-physician relationship is utmost confidentiality and privacy and secrecy, unless a judge overrules that, because only a judge can compel that stuff to happen, because we are licensed by law. The judge is the law authority. So, and that's not very common that happens. So in other words, most times you can be very, very safe, feel very safe that your information is secure. And so, so that's why it's super important that you keep in mind what is a patient. And it gets really tricky, y'all. So if you run, like a physician, if they run for office, so like I ran for a school board position, I know Dr. Oz is running for something. I'm sure there's other physicians doing other things. And anytime we get up and we're talking about things in the medical realm that could be medically relevant, hey, make sure you get out and exercise because it's going to help with your cardiovascular health. Well, those are general understood principles. And then most times we do it with the caveat, we will say beforehand, consult your physician before you do a workout routine or whatever, because again, I don't know you like that. And I ain't trying to take responsibility for all your stuff if I don't know you. Vice versa, I do want to take responsibility if I do know you. So if you've signed your paperwork and you're sitting in front of me and I'm giving you advice that is tailored to you because I know your situation, then you're my patient, and I am legally and fiduciarily obligated to do what's in your best interest, meaning as long as we have that relationship, I can't work against you. There are principles of ethics like beneficence and non-malfeasance. Non-malfeasance is, do no harm. All of those things apply when you're a patient. And so, yes, I can't work against you. I have to work in your best interest. I don't want to hurt you, that sort of thing. And so, and then there are also requirements, and this is more state kind of related, or state dependent, which is there are responsibilities that I have to do once you become a patient. So in other words, I can't just walk away from you and be like, deuces, good luck, see ya, right? So it doesn't work that way. If for some reason I feel like I can't work with you, or you're not following your treatment program, or you don't like me. There are certain steps that I am legally required to take because you are a patient. So it actually protects you and protects me and protects the profession and the public and the whole nine yards. So and those requirements oftentimes are, yes, you have to be available for a certain number of days after you end your patient physician relationship. And so, yeah, so being a patient, that label is just really, really important. Um, it is never a pejorative term. So I've heard that before. It's kind of like, well, that can feel very paternalistic, as if I'm some type of medical knowledge overlord over someone, and by referring to them as patients, that's pejorative. That's some kind of speaking down to them, and which blows my mind, because that is not how any of us are trained. At least nobody that's around me. It is a privilege to be a physician. It is a privilege for me to be in that capacity and in that role in your life. And so I think of it as we are walking together. Neither one of us is over either of us. We walk this path together, and then having a label helps us know where we stand. Right? Oh, I'm the physician, so this is what's expected of me. Oh, you're a patient. This is what's expected of you, and it's a very symbiotic relationship. And like I said, if something doesn't work very well, then we need to both dissolve that relationship in an amicable and very clear way. And then it is my responsibility, because I'm a physician, to make sure that I do my best to help you find someone that is a better fit for you. So, and that's a shameless plug also for Guide, which is my referral app that I'm building and populating. But that'll be a different day and different discussion for a different day. In the world of therapy, they use the term client. And so, and if you want to hear about that big discussion about the use of client versus patient, we have lots of videos on our YouTube channel, and you can check out our blogs and all that kind of stuff on our website. I won't go into that, but what I will say is that naming is important, so that, again, you define the relationship so that everybody has very clear expectations of what's supposed to happen. And so, I have lots of social commentary on people. I see politicians and I see celebrities, and I want to be like, "Ooh, that person has a personality disorder." Or, "Ooh, that is actually not bipolar disorder. That's actually trauma," right? And I can do that with myself. I do that with my colleagues, but in a public setting, that is not allowed to really comment on, because we are not that person's physician and they are not my patient. And then even if they were my patient, they would have to sign a form for me to be able to talk about it. And even then I still wouldn't do it, because it's just so problematic and tricky. And so, yes, you will probably never hear any doctor worth their salt giving commentary on their patient stuff in public without permission, and definitely not on people who are not their patients, because we take the sanctity of the patient-physician relationship very, very seriously. And that's why it's important to define what a patient is.